So, my friend, thank you for coming. You are coming from Italy. It's an honor for us to have someone from Italy and every country, of course. Here, you came for this varicocele surgery. Now it is finished, and after 2 days now, we are relaxed. You are relaxed
Yeah.
too. Thank you. You're coming with your father, and
Thank you very much.
Yeah.
Thank you very much.
Thank
We are
you.
very
Thank you.
satisfied.
Yeah, you are satisfied. What's your comments?
I recommend to check ourselves,
Yes.
especially in this kind of this branch of the medicine, because especially men, sometimes we are not ready to prevent.
Yeah.
Just we go to the doctor when we have problem.
Yeah,
So
always.
it's very important.
Always.
I'm 60.
New age is better than us.
Yes.
They are dealing with the problem more than us.
Yes.
If it were in our age group, people say, okay, forget about it, do it here, no problem. But he makes some research and find us. How did you make this research? Why did you make this research? How did you find us?
Yeah, I just found information on the internet actually very easily.
Why did you need this research? When if my doctor says me, hey, you need this operation, I will go into operation. Why did you have a concern?
Maybe it's just my personal tendency to.
Yes. New age is like
Yes.
this.
Yes.
They
So
are more making too much research.
To have more
More
informations and sometimes actually there is a chance to come across some new techniques and innovation that nowadays is spreading very.
Because it's a very easy surgery. It is the first surgery that we are educated, that are teach to us, and in our residency, it's an easy surgery. And every urologist will say, hey, why are you going to another country for this? It's an easy surgery. I can do varicocele in 15 minutes.
Yeah.
Yes.
But as you find in the internet, when you deal more and more, you see there are something wrong with this disease.
Yes.
People are not happy. They are having recurrences.
Yes.
They are needing more. For example, when the embolization came, we said, oh, well, how nice. No operation, just go into the veins and put something to block the veins that we are trying to do in the operation.
Yeah.
And it will finish completely. But then I was sending patients to embolization at the first.
Yeah.
Then people come, the veins are still there, they don't disappear. I said, what's going on? I couldn't understand first. Then we understand the anatomy. There are external veins, gubernacular veins, other type of veins. And sometimes inner veins are double or triple. So when they put the coil in embolization, sometimes they miss the other branches.
Yeah.
So this is a complex, this operation is becoming more and more complex every day. And you see our procedures in the internet, right?
Yes.
Yes.
And I was really happy that everything is explained very clearly, and you doctor are very easy to have a conversation with, and you don't have problem in explain everything in the details.
Yeah,
so I felt really comfortable and really in peace with the.
Yeah, it's better to talk before the procedure. We make a conversation, online consultation with you. It's good. It's better. Of course, I need some time to spare for these patients, at least for 30 minutes, to understand each other. So I make online consultations, and I make it with some charge. I charge it a little bit. It's sometimes I say, do I have to do like this? But I have to spare really a significant time for this.
Yes.
And I cannot every day wait on the cell phone and answer everything.
Yes.
It's not possible. I can't work like this. So, and people send me a message, for example, hey doctor, look at these results. Do I need operation? It's not fair. It's not easy to make the very important decision just with a message and send them, yes, you need operation. This is not true. And sometimes after 1 month, they send another result. Hey doctor, please look, what is the change with the other? So I go back to the other results, I read them again. It's 15 minutes.
Yes.
It's waste of time.
Yeah.
Yes.
So I said that, okay, this is not possible to deal with this like that. So I begin to make online consultations. and people pass me some amount, like 50 euros, and then we make sometimes longer than 30 minutes, whatever needed. So it's now better. We talk to you, we understand your situation. You show me the Vesuv, what's that volcano? Vesuv.
Yeah, Vesuvius.
You're home close to that? Yeah, the Vesuv volcano, right?
Yeah, volcano.
Yes.
Yeah.
Active volcano.
Yeah, I have some experience on the way back to Pompeii to Roma. Yeah,
Yes.
it was I go with motorcycle.
Yeah.
And it was a cold night in the middle of the summer. I couldn't believe how cold it was. Maybe you're passing through mountains.
Yeah, no, because the Vesuvius brings cold air.
Really?
Down. Yeah, because it's like a mountain actually.
It was really
Yeah,
cold.
yeah,
Really cold. We really trembled. Yeah, in the motorcycle. But
And it's crazy because there's plain land and then this gigantic just in the middle that seems to come from nowhere.
nowhere.
So it's a particular habitat because there is cities, but you just have to move 5 minutes to find yourself in the wild.
In the wild
Yeah,
mountain. Yeah,
in the
it's-
wild mountains. So
and you
it's
cannot believe how wild it's just looking from. Okay, this is the mountain, but it's
Yeah.
really different geography. Yeah, very nice
Yeah.
place. So then, what is your comment about coming to Turkey for this? Finding the hotel, finding this place, is it difficult?
No, actually, no. It was pretty easy. Now with the web, it's all
Yeah.
very easy to find the informations and all the things. Also, during the time I was at the hospital, everything was perfect for me.
Yeah.
All people were really kind and professional.
Although they are not good at English.
Yeah, maybe
Yeah, in
maybe
Turkey it's a
no
problem.
problem. It's okay.
It's a problem.
Maybe that just it's the only little issue that
Yeah.
could be improved, but maybe also with the translators and stuff, we
Yeah,
managed
but,
to communicate
For
through.
the main
Yeah.
main things,
Yeah.
like speaking with the doctor and for the surgery, they have always translator.
Yeah.
The,
Yeah, for the main
Yeah,
things,
yeah,
yeah,
yeah.
okay.
There are translators, so there are no problem at all.
Yeah.
So they are always there. They are very professional.
Yeah.
So I want to say thank you to all the staff and the
Thank
team
you.
of the hospital where
Thank
you had surgery.
Thank you.
They are so always there.
Yeah.
Continuously they take care of the people. So we have really our soul in peace now.
Yeah, this is important.
And,
For a father,
Yes.
your son make a decision. He will be
Yeah.
operated. Actually, it's good that you have some experience
Yes.
in those countries. You worked in Yemen, right?
Yes.
So you know how these countries are, and so because someone who never knows about
Yes.
nothing about Turkey, they
No,
will
no.
hesitate. At least
I-
hesitate. Is it a true decision? Good decision?
It's a high level of quality of life, and the people are kind. All around, it's a safety place.
Yeah.
So I feel really home.
Yeah.
And I suggest to come into Kenya not only for
Or even
health,
better, or even better.
or even better sometimes.
Yeah.
Sometimes we
Yeah.
have to say the truth.
At least for this disease, we get
Yes.
used to do it very commonly. So we are organized. I know how to deal with it.
Yes.
Of course, the most important part, the operation part.
Yes.
Your body were very kind to us. You have no fat tissue. Of course, your age and your you are sportive.
Yeah, healthy.
This is healthy
lifestyle,
and
yeah.
yeah, this is good. And the veins came out very easily.
Okay.
It was very too much advantage for us
Yes.
to have such a patient. Sometimes it is more difficult, and you didn't have any complications, thanks God.
Thanks.
And even if you have complications, we know how to manage them.
Yeah.
I know every kind of complication that we can have, and we need to lengthen the staying period, but it's possible. Sometimes if there is something extreme,
Yes.
like a very big bleeding in the scrotum, maybe we can delay the return flight a little bit, but it never needed before. I hope it will never be. So we are having some take detailed care. Be careful about this. Okay, so thank you very much for coming and sharing this with us. Because people always ask me, is it possible to come? Is it doable? Yes, it is doable. And in your operation, we were very lucky. Thank you.
Okay,
Thank
thank
you,
you,
Thank you
doctor,
very much.
from
Thank
the
you.
bottom of my heart.
Thank you.
Thank you.
Thank you.